Ladies and gentlemen, good evening. Dengue season is upon us. It is a season that coincides with the monsoon and leaves us with a deadly sting every year. As we speak, cases are spiking every day across the country. In Delhi, hospitals are fast filling up. In Dehradun, there are no hospital beds. And in Calcutta, protests and politics have broken out over the deluge in cases. The state of West Bengal, ladies and gentlemen, is the worst hit. The official case figure stands at 38,000. The number of verified deaths is 3, though the opposition is claiming that the Mamata Banerjee government is hiding data and that the actual death toll, according to the opposition, is somewhere around 100. This is important to note. 1,000 cases have been reported each day between September 13th and 20th, which means the rise in cases in West Bengal is alarming. The worst affected are the 15 districts of South Bengal, where 35,000 cases have been detected. Officials say that Bangladesh is witnessing a major dengue outbreak, which is stinging West Bengal as well. The leaves of 1 lakh government officials in West Bengal has been cancelled. The governor has had to cancel his trip to the United States of America as well. The chief minister's trip to Spain has come under heavy criticism from the opposition as well. She's back in India, but the opposition wants to know why she went in the first place when the outbreak had already started. Both the BJP and the TMC's own India ally, the Congress, have hit the streets with mosquito nets. Listen in.
মুখ্যমন্ত্রীর মায়না নেয় না, তার ঘরে কিছু নেই, তার কোনো ব্যবসা নেই, তার নাকি যে সমস্ত বই লিখেছে সেই বই লেখার পয়সায় নাকি তার সংসার চলে, অভাব হলে নাকি ছবি তৈরি করে সে ছবি বেচে তার নাকি সব কেনাকাটা হয়। তো দিদি, এতই যখন আপনার দুরবস্থা, তখন কোন অবস্থার দৌলতে আপনি স্পেনে গিয়ে বার্সেলোনায় সবথেকে বড় হোটেলে, যে হোটেলের ভাড়া 3 থেকে 3.5 লক্ষ প্রতিদিন, সেখানে আপনি আপনার পরিবার গোষ্ঠী সবাই মিলে কাটিয়ে এলেন কেন?
আমরা আমাদের প্রোটেস্ট রেখে গেলাম। পশ্চিমবাংলার লোককে আমরা বলতে চাই যে পশ্চিমবঙ্গে ভয়াবহ ডেঙ্গুর অবস্থা। আমরা একমাত্র বিরোধী দল পশ্চিমবঙ্গের, আমাদের দায়িত্ব এই বিষয়ে সরকারকে জানানো। এর আগে মুখ্যমন্ত্রীর নিযুক্ত অ্যাক্টিং চিফ মিনিস্টার, স্বরাষ্ট্র সচিব আমার সঙ্গে মিট করতে চাননি, পরে অন্য ডেট দিয়েছেন। আজকে আমরা একটা রিপ্রেজেন্টেশন নিয়ে এসেছিলাম, এমএলএরা 22 জন এমএলএ সই করে আমরা একটা রিপ্রেজেন্টেশন এনেছিলাম। টেস্ট কিট নেই, ডেঙ্গু ভয়াবহ, করোনার থেকে ভয়াবহ আকার নিয়েছে, 100-র বেশি মারা গেছে, কয়েক 10 লক্ষের বেশি আক্রান্ত।
This is a total frustrated person. You see, dengue is a problem, but the government and the local authorities, they are trying their best to counter dengue. And Shubhendu Adhikari, he is doing nothing but cheap politics. So they are interested, BJP is interested only to have some publicity, so they went there.
Okay, we will get into the politics in just a bit. First, some facts. What is dengue? It is a viral infection that is caused by the bite of an infected Aedes mosquito. The virus is commonly found in tropical and subtropical regions, which is why India is a perfect breeding ground for the virus. But here's the thing. Global warming has ensured that mosquito-borne diseases are spreading to newer parts of the world, like Europe. Dengue, for example, has increased 30-folds over the last 50 years and now affects 100 million people in 100 countries annually, every year. Typically, symptoms range from flu-like fever, headache, joint pain, nausea, vomiting, diarrhea as well. Thankfully, it's not contagious. Right now, it is the DENV2 strain of the virus that is in circulation and is driving the surge in most parts of the country. It's a more aggressive strain that can result in shock and hemorrhage if not diagnosed in time. Let's find out a little more about it. Dr. Rommel Tickoo is the Director, Internal Medicine at Max Healthcare, joining us on the broadcast. I'll come to the politicians and the spokespersons in just a bit. Dr. Tickoo, I'm starting with you first. First things first, since dengue season is upon us, and before we talk about the strain, I want to ask you, Dr. Tickoo, what should our viewers do to ensure they don't get dengue?
Well, I would say there are two ways to prevent dengue. One, there should be no mosquito breeding around your house. So there should be no stagnant water. The flower pots, the overhead tanks, everything should be cleaned. And the authorities have to get their act together. There should be intensive checking campaigns, awareness campaigns. People should know what to do, what not to do. And then comes personal protection, which is very, very important. Cover your body so that you don't have mosquito bites. And inside your house also, use the nets. Close the doors and windows, especially at dawn and dusk, when the mosquito gains entry into your house. Use the coils, mats, sprays, whatever you can do to protect yourself. So there are only two ways: prevent the breeding and personal protection. See, we don't have a vaccine yet against dengue available in India. There are two vaccines which have been approved since 2015. One was approved last year, Qdenga, but the vaccines have their own limitations. They are not that efficacious, and they're only approved in a few countries. Till we have a vaccine in place, personal protection is the key.
Okay.
And if we have a flu-like illness, as you said, or fever, so get tested on day one. There is a test, dengue NS1 antigen, which you can do on day one. You don't have to wait for 3-4 days. See, that leads to trouble. If you know you have dengue on day one, you will take all the precautions. You'll stay well hydrated. You will do your CBC or the liver function test every other day. Be in touch with your doctors to prevent complications. And for that, early diagnosis is the key. And please don't self-medicate. Don't take over-the-counter painkillers. They can cause problems. They can decrease your platelet count. They can cause gastritis, vomiting. And there is no place for antibiotics. It's a viral infection. There is no specific treatment for dengue. It's all symptomatic treatment. If you have fever, take paracetamol. If you have a rash, take an anti-allergic tablet. But I say the most important thing is hydration. Drink at least 3 to 4 liters of water. Stay in touch with your doctors. Get regularly tested. Initial 5 days, there will be fever, headache, body ache. But after that, the platelet count might drop, and some people might progress to hemorrhagic fever, where plasma leak happens, leading to hemoconcentration, liver dysfunction, and some patients actually need ICU care as well, because if it progresses.
Okay, Dr. Tickoo, you are telling us get tested on day one. How do I know I need to get tested?
See, if you have fever in this season, see, these symptoms are common to COVID, flu, typhoid. You will have fever, headache, body ache on the initial 2-3 days. So the only way to figure out whether you have dengue or not is to do a blood test. So anyone who has fever beyond 100, get tested. It's a simple test. It's not very expensive, and you get the results the same day in a few hours. So if you have fever, get tested on day one during dengue season. I would say that is the key.
Okay. So, doctor, can I ask you about this DENV2 strain that is doing the rounds? We are hearing about it and reading about it over and over again. We are being told it is more aggressive. Can you just tell us a bit about it, sir?
See, there are 4 strains, and dengue virus 2 strain leads to hemorrhagic fever. As I said, it leads to plasma leak, hemoconcentration, hemoglobin falsely goes up, liver dysfunction happens. It's a more aggressive strain, can lead to complicated dengue. The rest of the strains are milder compared to dengue strain 2. And this strain seems to be the one which is leading to a spike in the cases in India right now, even in Delhi. It's the dengue virus 2. See, whichever is the strain, one has to take precautions. Prevention is the cure. Make sure you don't get bitten, because there is no specific treatment. So the sooner you know you have dengue, the better it is, and stay well hydrated. Drink at least 3 to 4 liters of water. It's not only about platelets. The platelet drop will happen much later. Initially, it's just about hydration.
Okay, Dr. Tickoo, my last question then. The general belief in our country is that you can simply drink papaya leaf juice or goat's milk, and that will, fix your platelet count. Any caution that you would want to give our viewers who are probably watching and already have done it in any case over many, many years?
See, I don't know how much it's going to help, but it might not harm them. So these nuskas people do, every time. Even in COVID, we saw people doing lots of stuff, which is debatable actually whether it helps, doesn't help. But though there have been a few studies which have said that this papaya leaf juice does help. So I won't discard it. But see, you have to be under a doctor. You have to go under medical supervision. This is not enough. I would say that that's not the treatment as such. You might do it, but stay in touch with your doctors, listen to what they have to tell you. Hydration is the key. See, all this platelet count dropping and all comes much later. The platelet count going down doesn't usually lead to fatalities. It's the hydration which is important. If you are dehydrated, if you're not drinking enough water, your platelets might be normal, but you will be sick enough to be in the ICU. So it's not only about platelets. It comes much later. Hydration is important. Early diagnosis is important. No self-medication. Don't take painkillers. They might decrease your platelets. They might cause gastritis, renal failure. No antibiotics. Test on day one. Be in touch with your doctors. Regularly do CBC. So whoever has a flu-like illness, even if you have cough, cold, do get tested for dengue. That is the message which should go to everyone during dengue season.
Okay. Okay, and prevention is better than cure. So personal prevention is key. That is what you need to do before you do anything else. My last question to you, Dr. Tickoo. One of the things that officials are saying in West Bengal, it's in West Bengal where the cases of dengue are the maximum as we speak, officially on record around 38,000 to 40,000. But the opposition there is claiming that it's about 10 lakh. The real figure in any case in India, we never get to know. So, but we'll keep that aside. Let's just quickly talk about West Bengal, because one of the things that officials are saying is that there's a major outbreak in Bangladesh, a major dengue outbreak in Bangladesh, which is why West Bengal is feeling the sting. How can the two be related given the fact that dengue is not contagious?
Well, because of the proximity to each other, because of the climate, the humidity, and that is the reason. Otherwise, I don't see any other reason. And you see, in this season, you see dengue everywhere, whether it's Bengal or whether it's Bangladesh. You expect cases to go up during this season. And as I said, it's the climate, the humidity, because it doesn't get transmitted, as you said, from one person to another. It's only the mosquito bite which leads to dengue. So I don't see any other reason.
Dr. Tickoo, we leave it there for the moment. Thank you very much. You're telling us some very important things. A, prevention is better than cure. So ensure there is no stagnating water in and around your house. B, if you get fever, please get yourself tested on day one. Don't self-medicate. That is very important. And keep drinking water. Keep hydrating yourself. Dr. Tickoo, good tips. Thank you very much. Hope all our viewers follow what you're saying and stay safe. Thank you very much. But we can't be safe enough from politics in this country. Thank you. Thank you, Dr. Tickoo. Priyanka Tibrewal, spokesperson of the Congress Party, BJP, thank you very much. Good to have you, Priyanka. Hi.
Good evening.
JP Majumdar is State Vice President and spokesperson of the TMC. Thank you very much. Good evening to you as well. And Meeta Chakrabarti is a Congress spokesperson joining us on the broadcast. All three of you, good evening. Thank you very much for joining us. Priyanka, I'm coming to you first for obvious reasons. I want to understand why the BJP would want to organize a protest over a public health crisis. And where are you getting these figures of 10 lakh people being infected and 100 people having died in West Bengal because of dengue? Where are these figures coming from?
See, I'll tell you, the reality is, if you are talking about the figures, it is never that this state government, after it has come to power, it has never been comfortable in sharing the figures. Now, I have with me here data where it talks about the dengue cases and deaths in the country since 2015. And it is available on net. If you go to West Bengal, which is on item number 29, you would see that in 2019, no data was reported. It is NR. So it is West Bengal during the time of COVID, as well as with this dengue data, they never report any kind of data. They are not comfortable. Not just this. Even if you go to the rape cases and molestation cases with women, they never report the same because they want to show that there is nothing wrong in West Bengal. Everything is absolutely perfect. See, as opposition, our task is, it is our duty to find out that what is happening in the state with the people on the ground. See, what we are actually saying is that surveillance of dengue, it can help to limit the diffusion which is happening all around in West Bengal, because if they target the vaccination campaign, but this is not happening. Instead, what is the government trying to do? They are trying to hide the data. They are trying to do all this by, their arbitrariness in doing so. And look at their approach. It is so lackadaisical. They do not want to share the data. And if you will question them, they will say that it is cheap politics. Now, I don't understand that people dying, how come it is cheap or pricey politics in this? It is about your giving the figures. You tell us what is the state government doing. You tell us what is the health department, the Ministry of Health and Family Welfare doing.
Okay.
See, as we are government in the center, we are so open, we are so obvious about the figures. We don't hide anything. Everything is uploaded in the websites, and you can see everything centrally regarding all the states, even the states which do not have BJP government, but except West Bengal, because they don't share data. Now, whenever you will ask them any questions, they will say, where is the fund? Where is the fund?
Acha, Priyanka, give me a chance to ask them that question now. Just a minute. Mr. JP Majumdar, you've heard what the BJP is saying. They are saying you're simply not transparent when it comes to data. Please respond to the charge that is coming in from the BJP that, the West Bengal government under Mamata Banerjee is an expert in hiding numbers. For example, sir, it is very hard to believe that West Bengal is reporting only 38,000 cases of dengue and that only 3 deaths have been verified.
How I can respond? Just when BJP, my friend, is coming with a bag full of lies and publicity of misinformations and disinformations. The question is, the Chief Minister herself, standing in the assembly, has given the total data few days back, 1.5 weeks back, in the assembly. She has given that how many are at that point of time were affected by dengue, what government is doing in detail, and that should be the place. The legislative assembly, there should be discussed. But what BJP did at that point of time, just they walked out of the assembly. That is the thing. They want to go to today. You take today's incident. They have gone to the Swasthya Bhavan, the headquarters of health in West Bengal, and stopped all activities, closed the door. And as a result, a crucial meeting of West Bengal Medical Council could not be held. And what's the timing? At the timing of the dengue attack throughout the state. And who is stopping this thing? BJP. They want to put trouble, put hurdles for the work of medical people, for the people. They don't want it. They want to.
No, but Mr. Majumdar, you can say that they only want to cause trouble and they only want publicity. Mr. Majumdar, you can say they only want to cause trouble and want some publicity, cheap publicity. But the fact is that is the job of the opposition. The job of the opposition is to keep the government honest. And they are asking you questions.
No, Shreya. The job of opposition is not to go against people's welfare. The question is Modi. Mr. Modi told us, entire country during COVID attack, that there is no scope of politics. And all the states throughout India, they have joined force together because it was the cause of humanity, cause of welfare to the people. The opposition has politics to on the other issue.
Okay, fair point.
So
fair point. Why play politics over a public health issue?
Why they have stopped activities in
No, only then
today?
in that case, it's not just the BJP that has to answer. Okay. Mr. Majumdar, in that case, then it's not only the BJP that has to answer, it is also the Congress, which is your own India ally, that needs to answer. Because we were just seeing pictures of mosquito nets.
Just a point. Because Dr. Tickoo has raised a very crucial point about, you have asked him about Bangladesh and West Bengal. Historically, undivided Bengal, due to their climate and geographical situation, they have such vector-borne diseases. And you see the mosquito and other things, vector-borne causes in this season due to high heat, high temperature and humidity that has spread. It's a scientific thing. And scientifically and with everyone's support, I want BJP to come and
Okay.
help the whole system, not to oppose it.
Meera Chakrabarti, you're a Congress spokesperson. The Congress has held, has held protests as well with mosquito nets. We've seen them on our screens. There are questions that have been raised by your senior leaders about Mamata Banerjee going off to Spain when there was an outbreak of dengue in the state. Why link the visit to Spain to what is happening in West Bengal? The fact is that what is happening in West Bengal is not new. Yes, the number of dengue cases are spiking, but they spike every year. Is it your contention that the West Bengal government has done nothing, absolutely nothing to try and control dengue in the state? That they've just shut their eyes hoping that the issue will go away, blow away to Bangladesh, hopefully?
Good evening to all your viewers and good evening to the fellow co-panelists as well. Firstly, yes, dengue has been an issue, especially at this time of the year. Every year we have these problems. But it is clear and it's pretty evident that not enough is being done by the West Bengal state government to control the number of dengue. We are hearing reports of death where the cause is stated as unknown fever by many hospital professionals. Fact is, if we do not have access to correct data, proper measures can never be taken. So what are our points? Our points are very simple. Our points are that share the right data. We need to know how many dengue affected patients are there, how many people have died, and share us the correct data so that we can plan, so that we can help you probably by giving you right suggestion to plan a proper, to have a proper action plan. Our second query is to ask what all things are being done. Now, a professional from the West Bengal state government has gone on record and stated that there are areas which are inaccessible, where they have not been able to reach or where they have not been able to do the spraying exercise. So we want to find out what are you doing in those areas. Now, as a responsible political organization, and it should not matter whether we are in an alliance or whether we are in opposition, it is our responsibility to raise issues that affect people on a day-to-day basis. When people of the state are suffering, when people are dying, losing life, and just because it used to happen 10 years back, it should happen 10 years thereafter is absolutely a nonsensical logic, because medical science is making progress by leaps and bounds. It's our responsibility to hold the state government accountable and to seek an action plan, and that is exactly what we are doing.
Mr. Majumdar, respond to that, Mr. Majumdar, and take 20 seconds to do so, please.
No,
Mr. Majumdar, respond to that. 20 seconds.
Yes, my Congress press doesn't know a basic fact. What Dr. Tickoo just now said, that during last 10 years, that dengue has risen by 10 times throughout the world. Even Europe has now dengue. And she's saying why 10 years back it was what, and now why it will be so much. It is increasing throughout the world. She should be knowing. But one thing I want to know from him.
No, Mr. Majumdar, that is not the point she is making. No. That is not the point she is making. The point she is making is, if you expect us to give you suggestions and help you and not do politics, we need correct data. The data that the West Bengal government is putting out is simply not believable. The BJP and the Congress are both saying the same thing. Can you imagine that? The BJP and the Congress are on the same page when it comes to that one demand.
Shweta, in Bengal, the National Congress outfit of Bengal is run by BJP. Everyone knows here. They are just extended form. One side, BJP is the middle, CPM on the left, and Congress on the right. They are the rainbow alliance. So don't worry about that thing. And we going to defeat them all in West Bengal. Question is that the data
no, but please remember that the Congress party is your own India ally.
No,
Mr. Majumdar, please don't forget that the Congress party is your own ally at the center.
I know. All India basis, we are India. But in West Bengal, they prefer to support BJP. That's a factual position.
Okay, India is India and Delhi, but India is not India and West Bengal. That is what you are saying.
No.
Priyanka Tibrewal, I'll give you the last word here. Okay. Mr.
Yes.
Majumdar, just
So
a minute.
that's what
Priyanka
I'm
Tibrewal,
saying,
I'll give you the
ma'am.
last word here. Mr. Majumdar
The
is saying,
figures on your-
एक
the figures on your
minute,
screen.
Priyanka, एक minute. Guys, give me a minute. Give me a second. Priyanka, just let me ask you the question because I don't have too much time. My question to you is simple and it is this. When Mr. Majumdar is saying that the Chief Minister 2 days ago has come to the Assembly and put the figures, dengue figures, the number of cases and the number of deaths on the floor of the House, why are you doubting and questioning the Chief Minister? You should be standing with her
It's a
instead of
blatant
pointing
lie.
fingers at
It's
her.
a blatant lie.
Why
They
doubt
are
the figures?
accustomed to do that every time. It's a blatant lie. See, the figures on your screen are speaking about the entire working of this government. Now, we as people of Bengal want the government to be more transparent. What we are asking them is that you tell us the process of management which you are following. What is the waste management in West Bengal? How are they collecting all this garbage process? What is the, access of drinking water to people? Show us the transparency. Let us know how your public health system is killed. You are not giving these answers. That is the reason during Corona also, dead bodies were burnt here and there because they did not have a proper administration system. This is what we are saying. This is the failure. The obvious solution to control all this waste thrown around us to have a management system, which they do not have. Because they are more busy, the corporation is more busy in illegal construction rather than this management. This is what, as people of Bengal, we need to tell them.
Okay, we'll leave it there.
Show us your transparency.
Okay, we'll be, We'll see if the West Bengal government releases fresh figures. For the moment, what we have is 38,000 and 3 dead officially verified. But as our panelists are telling us that, there are people who are dying because of dengue, but their deaths are being attributed to common fever. So that happens. That happens, by the way, not just in West Bengal. That happens across the country. But we'll leave it there for the moment. It's a story we continue to track closely here. Calcutta, one of the worst affected in West Bengal. Priyanka Tibrewal, thank you very much. Mr. Majumdar, thank you very much. And Meeta Chakrabarti, thank you very much as well. Ladies and gentlemen, I'm just going to say this. You've already heard Dr. Tickoo at on the top of the show. There are some things he's telling us to do. A, ensure there is no water stagnation in and around your house. There is no water stagnation in and around your colony. If there is, haul up your civic authority and your civic representative. Ensure that water stagnation is done away with, because prevention in this case is cure. There is no vaccine for dengue and there is no medicine that cures dengue. It's all symptomatic cure. So you need to be cognizant of that. The second thing that you need to ensure is that if you get fever, along with some body pain and a headache, on day 1, get yourself tested. It could be dengue. This is dengue season. Anywhere in the country that you are, not just in West Bengal. You could be in Dehradun. By the way, Dehradun is where my mother comes from. And I can tell you that all hospital beds are completely full. But is anyone talking about dengue in the state of Uttarakhand? No, because we don't have the figures. But anyhow, the fact is that ensure that you get yourself tested on day 1. That will be very, very helpful. And thirdly, very importantly, Dr. Tickoo is telling us, don't do ghar ke nuske. Don't try and cure yourself. Indians are in the habit of, going to the kitchen and finding some sort of gharelu cure for everything. Don't do it. That is not how you deal with dengue. Speak to a doctor. Speak to a doctor. It's important. Your entire medication should be prescribed by a doctor. And third, very, very importantly, keep yourself hydrated. Keep drinking water. So that's the advisory from a doctor. We'll leave it there for the moment. The politics can continue. That's the nature of our country. But there is something else I want to talk to you about as well. Something called Disease X. Have you heard